We begin with the deteriorating situation in northern Gaza, where at least 7 children have died at the Kamal Adwan Hospital, most from malnutrition and dehydration. The Israeli military has tightened restrictions on the delivery of humanitarian supplies, and dozens of children admitted to hospital in the north are going without proper medication. Al Jazeera's Anas Al-Sharif gained access to the hospital and sent us this report.
We are inside the neonatal intensive care unit at the Kamal Adwan Hospital, where we have a number of newborn babies who are suffering from severe malnutrition and finding it very difficult to obtain the required medication and treatment as the Israeli occupation continues to prevent relief and humanitarian aid and medication from entering the Gaza Strip and reaching these newborn babies, as well as the patients and the wounded in northern Gaza.
We used to admit 500 to 600 babies a day into the hospital. Now we admit between 1,000 and 1,200 babies a day. We notice that all patients are showing signs of paleness and weakness. Second, a picture is worth 1,000 words. Even newborns are emaciated. In the past, every newborn baby would have their own box of milk. And today, we can barely find a single box for the entire department. The majority of newborns we are treating today at the Kamal Adwan Hospital are without parents. They were referred to us by shelters or other hospitals, and they are without their mothers. Therefore, it's incumbent upon us to offer them food and medical care. The situation is absolutely catastrophic. We usually feed newborn babies every 2 to 3 hours. However, due to the limited supply, we're forced to feed them every 4 or 5 hours instead, and this affects their weight. Whatever milk we have is split equally amongst everyone, and this will definitely affect the baby's weight and their daily progress. Additionally, given the poor health they're in when they're admitted, they need a sufficient quantity of milk to support their immune system, and the current shortage prevents the babies from recovering properly, which means they have to undergo treatment for a longer period of time. Usually, once newborn babies have recovered, we give them small doses of milk to try and gauge their health and find out if they're recovering well. However, given the limited supply, we are using a 10% glucose-based solution to try and get them to stop crying.
I'm scared for my child. She has sepsis and a severe chest infection, and she is only 23 days old.
Death continues to haunt everybody here in northern Gaza as babies and adults continue to starve due to the occupation preventing the entry of relief, humanitarian and medical aid, including baby formula, into the Strip.
Sharif, Jazeera, Gaza.
We can speak now to Alexandra Saieh. She's head of humanitarian policy and advocacy at Save the Children. She joins us now from Washington, D.C. Thank you so much for your time. NGOs like yourself have been warning for weeks now about the dire situation in northern Gaza. Now we hear that 6 infants have died just in the last few hours from malnutrition and dehydration. Is the worst now upon us?
Exactly. What we're seeing now is the worst case scenario unfolding right before our eyes. Our organizations who have been working on the ground in Gaza for the last months have been warning that children were going to start dying of severe malnutrition and disease, and that's exactly what's happening. And in the last few months, what we've seen is that reports are indicating that food insecurity and malnutrition in Gaza has only intensified by the day. And we also know that this is because of the relentless Israeli bombardment, the ongoing restrictions that have prevented the safe delivery of humanitarian assistance, and the complete decimation of civilian infrastructure and services. That's what's leading to this situation right now.
How long would these infants, these 6 infants that have died in the last few hours, have been without food or adequate nutrition in order to have died from starvation?
It's difficult to say because the situation varies, and we know that it's much worse in northern Gaza. But what I can say is that when children suffer from severe malnutrition, they are at higher likelihood of dying from common diseases like diarrhea or pneumonia or common colds because their bodies just can't withstand it. And we know that in Gaza right now, 90% of children under 5 suffer from some sort of infectious disease, and more than 70% have suffered from diarrhea in the last 2 weeks. So the situation is dire and it's getting worse, and it won't get better unless there is a ceasefire and we're able to scale up humanitarian assistance.
What about the long-term impacts on children of not getting adequate nutrition for such long periods of time?
When children suffer from this level of malnutrition, it has a long-term impact on their physical and cognitive abilities. It'll affect them in the long term in terms of their development. We may see stunting, immediately their muscles waste away. And, this situation has been getting worse over the last several weeks. Just the other day, one of my colleagues told me that in northern Gaza, her family members were using animal feed to feed their children, to keep them alive. And so the situation is desperate and only getting worse.
And presumably, people giving their children animal feed or feeding them leaves or so on because they are desperate, but that in itself can lead to health problems.
Absolutely. And it just shows the level of desperation that we're seeing amongst families in Gaza. I mean, we also are seeing and hearing that some families are trying to leave northern Gaza to get to the south, to Rafah, even though Israeli officials have said that there will be an expanded ground incursion. And so it just shows the level of desperation. Families are trapped between one death trap and another.
And you talked about the situation in the north, which is particularly acute when it comes to starvation. I mean, what is your understanding about why the situation in the north is so bad?
The situation in the north is so bad. Well, first of all, the civilian infrastructure in the north has just been completely decimated, but also they've been almost completely cut off from humanitarian assistance. More than 50% of aid convoys or aid missions that were planned to deliver aid to the north were denied entry by the Israeli forces. And so that's why we know that the situation is particularly bad in the north.
Thank you for your time. Alexandra Saieh, Head of Humanitarian Policy from Save the Children. Thank you.